therapeutics drugs level. Here we get a list of drugs and their therapeutic levels. So if you give them less than this, drugs does not work. If it is more than this, they will be toxic. Carbamazepine, it is the anticonvulsant anti-seizure medication. Therapeutic index is 4 to 10 microgram per DL. Another one is a digoxin. Other name is called lanoxin. Digoxin we use as a cardiac glycoside. We use for heart failure patient or cardiac patient. So if digoxin therapeutic index is 0.8 to 2 nanogram per ml. So if your patient need to give digoxin, we could monitor serum electrolyte level, because hypokalemia, hypomagnesemia, and hypercalcemia precipitate digoxin toxicity. The major sign of digoxin toxicity, patient develop bradycardia, which is lead to arrhythmias, difficulty or disturbance, visual disturbance of blur of vision, or GI upset. Some patients explain yellow hollow around the light. Second medication here, gentamicin, it is the antibiotics. The therapeutic index is 5 to 10. Right? Another medication is tobramycin, same antibiotics, aminoglycoside groups drugs, 5 to 10 microgram per DL, same number. Lithium is a mood stabilizer. Therapeutic index 0.8 to 1.5 is almost same digoxin. Some books said it is 0.6 to 1.2. Lithium toxicity develop if it is more than 1.2. If the lithium toxicity is very severe, patient develop nephrotoxicity, cardiac toxicity, and hypotension. So it is, keep in mind, lithium toxicity increase when the sodium level go down. So we have to monitor the sodium level, because hyponatremia increase the risk of lithium toxicity. Keep in mind, lithium is always give with food. Phenobarbital is an anticonvulsant. Lithium toxicity is 15 to 40. Phenytoin or dilantin we use as an anticonvulsant, anti-seizure, antipsychotic. Therapeutic index 10 to 20. Theophylline is a bronchodilator. Aminophylline bronchodilator. Therapeutic index is 10 to 20. It's similar to phenytoin. Right? Another is valproic acid, anticonvulsant. Therapeutic index is 50 to 100. And vancomycin, broad spectrum antibiotics, therapeutic index is 20 to 40. So what are the difference between valproic acid therapeutic index and digoxin therapeutic index? Digoxin or lithium therapeutic index is very narrow. So the patient has a chance to develop toxicity very quickly. But valproic acid or vancomycin therapeutic index is very wide. Patient less chance to develop toxicity. Two more medication we left here. One is Maxalf. Therapeutic index is 4 to 7 milligram per DL. Maxalf we use pre-eclampsia and eclampsia. pregnancy-induced hypertension and complication. It is 4 to 7 milligram per DL. If patient develop maximum toxicity, we see areflexia is a sign of toxicity. We have to monitor the reflex. If we see the toxicity, we should stop the infusion of Maxalt, also assessment all of the reflexes. Last one here, acetaminophen. Acetaminophen we use as a very mild pain medication or antipyretics we use for the fever. We can buy acetaminophen over the counter. These drugs, therapeutic drugs level 5 to 20 milligram per DL. So if patient develop acetaminophen toxicity, we give them antidote, or most common antidote are mucomist or N-acetylcysteine. So before to acetaminophen use, we must know patient liver is working well. So use with some caution if patient have a liver problem, liver disease. Maximum dose we could use 3.5 gram per DL.